Hi, I'm Monica Weitzel. Welcome to Community Hotline at Home. Today, we'll be talking with the only medical clinic in Oregon devoted to African American Black health, the North by Northeast Community Health Center. For over 15 years, the North by Northeast Community Health Center has had the goal of offering primary care services and health education that focuses on the African American community. Systemic health and social inequities have become even more pressing during COVID-19. We'll find out what is being done to close the health gap here in Portland. With us today is Sharetta Butcher, Community Care Director. Welcome, Sharetta. It's great to have you on the show.
Thank you for having me.
You're welcome. Can you start out by telling me a little bit about the North by Northeast Community Health Center, specifically who you serve and that kind of thing?
So the clinic was founded by Pastor Mary Overstreet and Dr. Jill Ginsburg. 2006, it was like right after the hurricane happened down in the Gulf that Pastor Mary went down and brought 10 families up to Portland to relocate after the hurricane. Dr. Ginsburg went to the church to make a donation, and her and Pastor Mary started talking about the clinic. And so what they started was a one-time walk-in clinic where folks could come on a walk-in basis who are uninsured, because at that time in Portland, it was like we didn't have that type of health care. If you didn't have insurance, it was a lottery system. So if you didn't come up on the lottery list, you did not have insurance. So what Pastor Mary was saying is, hey, we need some type of free health clinic in the community.
I mean, what were people doing if they didn't have insurance?
Going to the ER, going to the emergency room for care. And that's kind of even with the same with the Obamacare, the Affordable Care Act change that allowed folks to be able to have insurance, decreased the care that the emergencies room had to do for just routine stuff.
And it's focused primarily on the African American community, is that right?
Some years back, maybe 4 or 5 years back, we became more focused on African American health. We go to all kinds of fairs. This is before COVID. We take out ads in the paper. Any event that's going on, especially in the Black community, we're there. And we're taking blood pressures. We have a program called Cuts and Checks where we go inside the barbershop and we take blood pressure of the African American men, because African American men have the highest blood pressures in the world. And so going to the barbershop where their domain is, they're relaxed, they're comfortable, and then we're able to take their blood pressure and talk to them about it.
How then did COVID affect you in doing your business at North by Northeast?
That was a boomerang. We really established, I'm going to say this about our health clinic. We really focus in on African American health, but we also focus in on relationships with all of our patients. And when people came in, we made them feel welcome. It was a home. It's a place of healing. When COVID happened, yes, it allowed us to continue to keep with our long appointments, but here we are now. We have masks on. We have this social distance that we have to do. And we really try to find any kind of way that we can make our relationship with them still personable, being able still to reach them. And so COVID has, I think affected everyone in how we do business, but it hasn't taken away the culture and our fabric of who we are with our clinic.
I like that a lot, Sharetta. That going to a doctor's office can be very, very stressful. But being able to go there and knowing that you know the people there and they know you and they care, that's got to make a huge difference. So what kinds of things do you do to reach out to them?
We have the radio ads still going on KBMS, and we still do outreach in some form. We did a little different since COVID. We've partnered with Multnomah County, and they gave our organization these gift cards $250 gift cards. And so we set up in the parking lot, but we also combined it in a sense with a little bit of our Safe Home Healthy Homes event. We gave out Sharps boxes where folks, and inside of it, we had put in where to go to get food and information about COVID, how to wash your hands properly, how to make a mask. And we put masks inside of there. So we made these little goodie boxes that people could come, grab and go. It was a grab and go event, kind of speak, so to speak. And the information was still getting out there. Folks were still getting educated about the things that, changes that were going on in the community, and had something in, it was a $25 gift card in there as well that they could take it and go shopping with. So we've given out food boxes. We had a couple of events where we just partnered with Oregon Food Bank and some of the Black farmers in Oregon, where they brought in fruits and vegetables and dairy and produce, and we just kind of gave that out. So we've been doing our Safe Home Healthy Home events just a little differently, but it's been more so meeting the needs of the community.
That's great. That's great, Sharetta. Yeah, because it's less contact, but they're still getting what they need from you and more. And then you mentioned Sharps containers. You have one of those boxes outside of your clinic, right, where people can drop off full Sharps containers.
Yes. Yeah. Yes. So that happened through the Patient Wellness Council. It was in a news story that broke about a little girl who was on the TriMet bus. And she sat down in the seat with her dad and she poked herself. And inside of there was a used needle that was in the seat. And so it really moved our Patient Wellness Council. We all were talking about it one night and we were like, we really need to get these Sharps off of the streets, and not only are they, dirty needles due to drug use, but they're also folks use them on an everyday basis, that like diabetics, who uses it for insulin, or folks who have to administer medications through a syringe. So it's like, what do we do with these used needles? So we started investigating, asking questions, and the nearest spot to take your used Sharps was down in Northwest Portland. Well, that wasn't going to work for folks that live right here in the community. There was no bus that went out there. It was just this isolated place. So it was like, what could we do as an organization to help out the community and have a safe place for them to drop off their Sharps? So we started talking to Metro in the city of Portland and found out about these Sharps box. These boxes have been strategically placed in drug affected areas in the city, but not thinking, not only drug users use needles, everyday folks use needles. So it's like, how do we, what can we do? So we talked to Metro in the city and they brought us a drop box. And then we just started doing a lot of advertisement. We went to pharmacies and we passed out these little 4x6 cards of telling them about the Sharps containers. We started hosting events that were focused around Sharps containers, like bringing in your Sharps. And I'll never forget this man. He's probably in his 60s, late 60s. He got off the bus, because the bus comes right in front of the clinic, got off the bus, and he was carrying 2 5-gallon buckets of syringe needles. He was a diabetic. He had nowhere to dispose of them, didn't know what to do. He knew not to put them in the garbage can, so he just started collecting them. And here he brought them to the clinic for a safe disposal. We weren't even thinking along that line, but it was something that happened, a spark. Just like how the clinic had started, it was a spark in Pastor Mary, a spark in the Patient Wellness Council that is like, we need to do something. And then by doing something, they're making these big impacts on the community.
That's great. That's great. It's really a community-led organization. It's for the community. It's about, it's community-led, which is a beautiful thing.
Yeah.
Which I want to get back to one thing. You talked about that the blood pressure for African-American men especially, or is it just African-American, is higher than any place else. And there are, historically it's been shown that there are a lot of disparities between the health of African-Americans and say whites, for example, and that there are social reasons why
Yeah.
that is. Can you talk a little bit about that before I let you go
Yeah.
today?
The lack of trust. I would say the bottom line is trust. African Americans were used as, I use the word guinea pigs, for testing different vaccines or different, just different things like tests. They were like testers.
Yeah.
Let's go to the blacks and use them. Let's try it out on them first, kind of thing. And it causes mistrust of how providers treated African Americans and people of color in the healthcare field. And I think it was devaluing, is degrading, and it allowed folks to feel like, they can handle pain. I mean, I know pain is a big one within the community, but if a white person walked into the ER with a broken leg, they were, 5 times more likely to get pain medication right away than it was if anyone who was African American go inside the ER with a broken leg and not getting any, So that started happening. And over the course of the years, like anything, it's from generation to generation to generation. So African Americans did a lot of things on their own home remedies to help keep themselves safe and healthy. And the trusting of a doctor, we didn't trust doctors, And so just because a doctor said I have high blood pressure, it could be something that's been accepted in my family for years. Like, oh, my grandma had high blood pressure, or my grandfather had high blood pressure, my mom has high blood pressure. So it's something that became like an acceptance, I think. And so African Americans was like, okay, well, this is just the way things are for us. And so we, as always, had to adapt and just deal with it. I don't think, and it just causes bigger gap in the healthcare field of us being comfortable and trusting what doctors and providers are saying to us.
But having a clinic that focuses purely on your community, then that's got to be more reassuring.
Yeah. And I think that's what is super good about the clinic. I really love the clinic, and not everybody who works at the clinic is African American. So just because you come in and you see somebody who is African American doesn't mean that you just automatically trust, the place. But I think it's how we talk to people and how we respect people, how we respect each other. Our providers are all white, and yet our Black patients love them. So it wasn't like, it was how people are treating one another. And I think the disparities happen when there is no trust and we don't treat people right. And I think we're seeing a lot of that, the top being blown off of that right now, right? We're all walking through that, right? But it's been going on for years, generations of the disparities. Yeah. So how do you go back and how do you go and try to fix it, And my thing is just like one relationship at a time,
I'm with you. I'm with you there.
Yeah. Just start building and working with who you come in contact with, and start there and just starting to see it grow. I mean, we have father and sons coming to the clinic, families that come to the clinic, and it's so funny because we hear a lot of folks, because we don't see folks who have insurance, private insurance, but you hear them all the time. They'll call and say, are you guys accepting private insurance now? Because they want to come and be a part of what's going on here. And so, yeah.
That's got to make you feel good about where you work, huh?
Yeah.
It's more than just a job. Yeah.
Mm-hmm. Oh, yes, most definitely.
Is there anything else we should know about the North by Northeast Community Health Clinic before I let you go, the health center? You've done a pretty good job of it.
Great place to be. Yeah. I love my job, and I don't know how many people can really say that they love, and I don't even really look at it as a job. It's a ministry. It's just like, it's a part of me. And I really love being here. And I think everyone else does too. We get along really well. Our staff gets along really well, and we show that. And by us showing that to the patients, I think that makes them feel more of a part of this family that North by Northeast has established. So
I have no doubt of it. I have no doubt of it. Thank you so much, Sharetta. You've done them proud. So, there are a lot of disparities. I know the whole Black Lives Movement and all this social injustice going on now is it's something that's in everybody's conversations. This is something people need to be aware of, that these are some of the injustices that have happened is in the healthcare field. So thank you so much for what you do, and to all of your coworkers and your whole community.
Thank you.
Yes, you're welcome. To all of you watching us today, thank you for joining us. And from all of us at MetroEast, stay safe, stay healthy. We'll see you next time.